Welcome to the QSEN module, Strategies for Making Assessment of QSEN Competencies Efficient and Conducive to Learning. As schools across the country work to integrate the QSEN competencies and requisite knowledge, skills, and attitudes into their courses and curricula, questions are now arising about how best to assess the extent to which students have achieved them. In this module, you will learn practical strategies you can use to assess students' achievement of the QSEN competencies, and that will provide both teacher and students with evidence of learning. Before we go further, we invite you to pause the presentation and take a few minutes to consider your assessment practices. On the top of a sheet of paper, write down what the word assessment means to you. In other words, what does it mean to you to assess students' competencies? Next, look at these two questions. List 4 to 5 of the strategies you currently use to assess students' competence and the areas you would like to explore that are not currently in your assessment repertoire. Let's begin by thinking about why we assess students. We are looking at knowledge, skills, and attitudes to inform how we teach. Assessing learning tells us about the quality of our teaching. Thinking about assessment is continuous quality improvement. It is important that students receive appropriate feedback, early and often, so they know how well they are progressing toward achieving of QSEN competencies. Feedback should increase familiarity and decrease anxiety. It should give early notice of difficulties and lead to better time management. Some things to keep in mind include minimize grading. The person who does the work is the one who learns the most. Use frequent assessment but light grading. Use your time wisely by giving appropriate and on-target feedback to the group. Quality feedback. Students need to hear what they are doing right and wrong. Include peer feedback and self-assessment. Be positive, but if the student is wrong, say so. Motivating students. Give a problem or question in class. Provide immediate feedback through class discussion. Require students to submit outlines or proposals for projects to provide direction. Schedule meetings with students to discuss learning goals for the course and review their competence. The assessment process should be tailored to fit the needs of the student, teacher, and institution. Assessment should become an integral and valued piece of the process and should be re-evaluated and enhanced regularly. Assessment is a process that leads to enhanced teaching and learning. The strategies we use to assess the QSEN competencies are interrelated. This slide shows how the competencies guide our instructional strategies that then guide our assessment techniques. Conversely, we use the results of our assessments to improve our current strategies and to implement new strategies to assess our competencies. Now we will discuss the design from learning goals to assessment. Learning competencies. What will the student know or be able to do? Consider measurable competencies that include competence. What will the students do? Conditions. Under what conditions will they do it? And criterion. How well will they do it? For example, looking at safety, the student would be able to communicate observation or concerns related to hazards and errors to patients in the clinical setting with 80% accuracy. Content and delivery. You can use readings, handouts, hands-on experiences, podcast, streaming video, or websites. Learning activities. These can include small group work, active learning techniques, problem-based learning, lecture, and student self-assessment activities. Assessment of learning. These can be graded or ungraded assessments. Assessment of the learning experience. You can use student tests, essays, midterm surveys, course evaluations, and simulations. You begin by asking what you want students to get out of this experience. In 2 to 3 years after students are engaged in this course, What do you hope the impact would be? Answers to these questions usually emphasize things like critical thinking, learning how to use course knowledge creatively or to solve real-world problems, such as improving patient safety, changing the way students think about themselves or others, and increasing a commitment to lifelong learning. What should distinguish students who have taken this course from those who have not? This is a different approach than the traditional content center manner in which we have traditionally taught. So we are no longer saying I want students to learn A, B, and C, a list of topics, a book index, or a previous course schedule. We want students to develop knowledge, skills, and attitudes related to the QSEN competencies. What is the significant learning experience in this course? If the learning is significant, students will be engaged in their own learning. There will be high energy level associated with it, and the whole process will have important competencies or results. Not only will the students be learning during the course, but at the end of the course, they will have changed in some way. For learning to occur, there has to be some kind of change in the student. If the learning is significant, the change is lasting. Module 5 discusses the research about how to level the QSEN competencies for beginning, intermediate, and advanced students. This can help instructors make decisions about what competencies to address where in the curriculum. Use authentic assessment. Ask the student to do the subject, that is, to go through the procedures that are typical to the discipline. In the quality improvement competency, the students would participate in a root cause analysis. Have students do tasks situated in a similar context to that in which the students will eventually apply them in a simulation activity. Assign tasks that are realistic and complex and require critical thinking, judgment, and innovation. Allow for feedback, practice, and second chances to solve the problems being addressed. Use small, frequent assessment. Students will become used to the testing format. Student anxiety will decrease. You will have earlier notice of student difficulties, and students will be more likely to keep up with their work. QSEN competencies are always a work in progress. We are always striving to improve patient care, so frequent feedback, practice, and assessment reinforce this. As we begin to discuss specific types of assessments, it is important to keep these points in mind. In order to evaluate a student on any competency, it is best to use a variety of assessment methods and strategies as seen in this slide. For example, to reach a decision about a student's level of competency in the area of evidence-based practice, the instructor should use a variety of the strategies. The student may have specific readings that have been assigned and will be assessed through a multiple-choice quiz on their knowledge of the content of the readings. They also may have a practicum experience in which the instructor assesses the student's skills and behaviors by asking them to describe why they behaved in a certain way. Was the care patient-centered? Was evidence-based practice used? Or the student may be asked to develop a portfolio in which they reflect on experiences and explain the evidence that would support what they are describing. They can identify how they have demonstrated each QSEN competency by identifying specific KSAs in their practice. Now we will talk about each type of assessment in a little more detail. Written assessments are most commonly used for summative evaluation within a course. For example, a midterm exam may have a combination of multiple choice items, short answer, and structured essays. This written assessment may be part of the overall evaluation of the course, which may include assessment of other experiences. These are the traditional types of assessment used in nursing education. While these types of assessment are familiar, it is important that we consistently consider the extent to which these assessments do or do not tell us about students' achievement of the QSEN competencies. For instance, How can our written assessments help us assess students' ability to identify system barriers and facilitators of effective team functioning, or to appreciate the risks associated with handoffs among providers and across transitions in care? Observation of skills and behaviors in assessment can be useful in a variety of settings and situations. Global rating scales are tools for using direct observation and recall of performance to assess KSAs that are not amenable to written assessment. Learning through structured observation can be assessed by having students record observations and data and to provide feedback about the observation. Standardized oral exams can be used across competencies. Skills and knowledge can be assessed when students demonstrate effective problem-solving skills. Working as a team, students can discuss and analyze a wide range of scenarios within the competencies. As an example, you could use the KSA of pain management in relation to patient-centered care. Working through the understanding of pain and comfort, the K, to the skills of assessment of pain and comfort, the S, and then recognizing their own values and beliefs about pain management, the patient's expectations of pain, and their role as a nurse, the A. As technology further permeates our teaching, simulation can be used to assess a variety of knowledge, skills, and attitudes simultaneously. The QSEN website has many resources for conducting simulation experiences to foster students' achievement of different competencies. Observing students' performance in a simulated experience provides important evidence of their competency achievement. This could include assessing the presence and extent of pain and suffering, or eliciting expectations of patient and family for relief of pain, discomfort, or suffering. Oral assessment can be used as a real-time assessment in the clinical and laboratory setting. One-on-one coaching about a specific outcome can be used as an integral piece of the assessment puzzle. During pre- or post-clinical conferencing, many skills, knowledge, and attitudes can be assessed. For example, students may be asked to give a report on their assigned patient to their peers and explain variation in the quality of care against established standards, or to describe how and what they have learned about the outcomes of care for their assigned patient and what improvements they would suggest. Written work samples can be used as formative assessment throughout the learning experience. Portfolios of specific nursing skills and concept maps, process recordings from conversations, as well as reflective journaling about a variety of experiences, can provide a wealth of assessment information. Compiling work samples over time can help students recognize their own growth and can help them appreciate the importance of continuous quality improvement. Think about how you might implement the above questions related to the QSEN Patient-Centered Care KSAs. This type of content could be incorporated into a wide variety of assessments. You could choose one question for a one-on-one coaching session, or use them during a debriefing of a simulation activity. The possibilities are endless. Assess course-related knowledge and skills to find out how much background knowledge the students have, to discover areas of confusion, to reinforce what is being taught. Classroom assessment techniques can test many levels of cognition: recall, analysis, synthesis, and application. Discover attitudes, values, and self-awareness of students. Focus on how and why, rather than the content. Assess students' responses to specific instruction in an ongoing attempt to improve teaching and learning. A one-sentence summary will help faculty find out how well students can concisely and appropriately summarize information on a selected topic. For this technique, it is important that you answer this question yourself as quickly as you can. Then provide the students twice as much time as it took you to come up with the sentence. For example, in relation to patient-centered care, is there a conflict or potential conflict in determining goals for care? How might you address conflicting goals or prevent conflicting goals in this situation? Take a moment to create a pro-con grid of classroom assessment techniques. As a classroom assessment, have your students discuss the pros and cons of a variety of strategies for improving systems to support team functioning, or discuss the influence of system solutions in achieving effective team functioning. Here are some other ideas. Minute paper. This is the most common format. Ask your students to recall and evaluate. It requires them to self-assess. What was the most important thing you learned today? What questions remain uppermost in your mind as we conclude this class session? The muddiest point. This is a more efficient assessment technique, and it gives the highest feedback for the shortest amount of time. Ask your students, what was the muddiest point in this session? What was the least clear to you? Punctuated lectures. Every 20 minutes, instructors actually stop the class and have students reflect, fill in notes, compare with another student, and give time for questions. Instant assessment. This non-threatening strategy to get to know your students allows you to assess instantly if students are understanding a problem. Clickers can be used with related technologies to create an interactive learning environment. If you don't have access to clickers, you can make responder cards for your students with A, B, C, D for multiple choice, TF for true-false, or numerical ratings. Assessment of students' achievement of QSEN competencies can be challenging for many reasons. For instance, many of us are working with large groups of students in each class or section we teach, dealing with the competing demands of service to the school and trying to maintain our own clinical practice. Such challenges make it important that we look at ways we can be efficient in our assessment activities. Think about what kind of feedback do I need when. Small and frequent can be just as helpful as big and comprehensive. The key is finding a balance. We can't assess everything. As we think about making decisions about assessment, the research by Barton presented in Module 5 can be helpful in leveling QSEN competencies and KSAs. As you reflect on these questions, what strategies merit improvement? Which should I no longer use? Which can I revise to give me and the student better information about the student's achievement? Furthermore, share these ideas and techniques within the QSEN website. As we work to change processes within the healthcare system, how can we change our process within nursing education? Just as continuous quality improvement is an essential part of our daily work as healthcare professionals, it should also be a daily part of our work as nursing educators.